Hello guys. How are you doing? um this is your girl Dr. Doris. Longest time. Well, what can I say? Welcome. Okay guys, so I'll just dive into the reason why I'm making this video today. I haven't been coming on my YouTube channel for I think about 2-3 months now, and there is a very good reason for that. I was actually preparing for my AMC clinical examination. My god guys, I passed my AMC clinical examination, guys. Now, what I have to say, if you're preparing for AMC clinical examination, you have to study. Seriously, the exam is tough, and not just tough. For me, the exam is very subjective. This wasn't my first attempt, guys, so I don't want to stay here and say this is my first attempt. No, it wasn't my first attempt, and like I was very close to the pass mark previously, but I didn't meet up. So but this time around I actually passed. I really thank God for like helping me to scale through in the AMC clinical examination, and a lot of things were on the line. I needed to pass this examination. I needed to. So what I'm going to explain to you is that if you want to do AMC clinical examination, I think if you haven't even done it before, you should actually do a course. I advise you do a course, really. Don't even try to study on your own and try. I advise you to do a course. The reason I'm talking about doing a course is that when you do a course, you'll be able to understand where you're weak and what has gone wrong. You'll be able to like make your mistakes during the course and then try to adjust it at least before the examination. And most importantly, even if you do course, you still need to do AMC clinical handbook. Like a lot of people will be like, where do I start from if I want to do my AMC clinical examination? And I advise that you should start from AMC clinical handbook. There is this. So what happened to me was that few days to my examination, a friend of mine sent me this AMC deep dive. It was just like an AMC clinical handbook, like podcast, where other doctors were trying to analyze all the cases one after the other in AMC clinical handbook. So I found that very good, and I actually found it very interesting, because just imagine that you are studying the handbook alone. It is very exhausting. Even when I did my AMC clinical, when I was studying the handbook for my AMC clinical exam, seriously, I couldn't finish. I just literally just did halfway and stopped. But I felt that the deep dive is actually very good. The reason I say this is because, like, let's assume that you're actually laying down and you're tired. You can put in like your AirPod in your ears and listen to the deep dive, listen to how they tackle and analyze the cases, and it's very quick. Like each of them is like 10 minutes. It's really quick. They really dive into it, state out all the key points, and then when you're doing and listening to the deep dive, I think it makes it more interesting for you to move with the same speed, like in terms of like quickly looking at what the handbook is saying. I found it very helpful. Okay, the next thing is I did a course. So the course that I did previous time I did the exam, I didn't even do any course. I just studied on my own, and I didn't succeed. But this time around I decided to do a course. So I did first aid AMC. I found that the course is very good. The reason I said this is because, see, sometimes some people will say I did the course and I didn't pass. Seriously, I feel that what the online teachers are there to do is just to help you to see what the exam is all about. It's to help you to see how you should be like doing the exam. Because for me, AMC clinical examination is like a dance, which you need to know how to dance. The dance is very hard. It's not just that this is the criteria for grading a doctor. I feel that even if there are criteria, it also has to do with subjectivity, because I personally feel that the exam is very subjective. Let's assume that the role player doesn't feel fine, like the way you were talking or something. You're failing that station, That's my own opinion anyways. I can be wrong, but this is my personal opinion, seriously. And let's also assume that the role player didn't hear what you're saying. You know, they can answer you the wrong thing. The exam is very subjective. There are so many things for you to learn as an international medical graduate, like going down to like the way you talk is very important, because you need to actually understand how to talk the talk. It's not just by talking the talk, no, you need to know how to talk the talk, you know, so that they can understand you. You need to talk it in an Australian way, you know, because of course it makes sense, because you're coming to practice in Australian land, you're coming to practice in Australian soil, so you just need to learn how to talk the talk, seriously. And very importantly, you need to understand time management. And I think this is also one thing that is very good with courses. Like when I did my pesky examination, I also did first aid AMC, and I love Dr. Ashan's course. He is like, I mean, there are so many other people say they've used Dr. Amir and other doctors that Arim Gas and other things, but seriously for me, I feel that Ashan Ahmed is doing the right thing, and I really thank him, because he has helped so many doctors too through his course, you know. And this is not an advert or anything, this is just me expressing myself as to how I felt, you know, because when I did my pesky with him, I cleared my pesky in first attempt. And the truth of the matter is that what I loved about his course was that the fact that we could do role play on a daily basis. And it's just like the teachers too, they're all general practitioners and they're all doctors, so they are letting you express yourself in what you know, and then they will correct you and tell you that this is not the right way, this is where you've made mistake, this is where you need to improve. You know, you get that first-hand information, you know, from them. So I really found it very helpful on a serious note, in terms of helping me to like do the exam. So doing the role play every day actually helped me with my speed, and it helped me with talking. So if you know that you know how to do role play, you can also have some group of people that you do role play with. But me, I didn't have the time, guys. Like if you've been listening to my videos, or if you've been following me for some time, you would know that I have a lot on my plate. I have twins that I take care of, and I literally still need to work because I work as a GP. So I do not even have all the time in the world to come and, you know, stay and be doing role play with people. The time always clashes. Let's say they say let's do this role play by 10 p.m. I do not always meet up with the time, because it's always one thing or the other. So what I did personally was that I just talk to myself on Miro. Like when I do all the courses, sometimes even when I'm doing the course, I do it in distraction, because I'm doing it and I'm taking care of my guests, I'm cooking. So I mean, I just do what I can with the course. But if you don't have a lot of commitment on your table, I would really advise you, if you're going to do course, you know, do course. Choose the course that you're comfortable with. For me, I did Dr. Ashan Ahmed First Aid AMC. If you choose the course, study the course very well. Like you literally need to go through all the notes and all the theoretical and every aspect of it like 3 to 4 times, you know. And First Aid AMC clinical handbook, you need to go over it like 2 to 3 times. If you use the deep dive, I'm actually going to attach the link of that deep dive to this video, so that if you think that you really want to listen to the deep dive, you can actually download this if you're preparing for AMC clinical examination. Okay, so those are the key things that I wanted to explain. So now what I wanted us to also know is that you need guidelines too. So I personally use therapeutic guideline and Royal Children Hospital guidelines, because I use them on a daily basis. Like when I see patients, I talk to patients, I always consult my guidelines. So if you're used to studying your guidelines, RACGP guideline, ATG, ROC, so that with AMC clinical examination and the course should be enough to pass AMC clinical examination. But you need to study hard. A lot of things, a lot of reasons, a lot of people actually do underestimate the examination. So they would say let them go there and try their best. And I mean, AMC clinical exam is not an exam you go on luck. I mean, luck plays a big role, but you need to be prepared. You need to study really hard. Like for me, I'd say the normal length for you to prepare for your AMC clinical exam is like 6 months, and that has to do with you finishing all the cases. Like you need to do the cases like 3 to 4 times. You know, there are high yield questions, even result interpretations, you know, because even my exam that I recently passed, I noticed that there were so many result interpretations on different levels. So you need to study all those result interpretations, all those topics in clinical handbooks. Really, those are high yield, so you need a big role. And physical examination, you need to know how, like, all the examinations, how to do them one after the other. For my physical examination, I used GKIMED. At first, I wanted to use Tally O'Connell, but it was too vast. It was too extensive. Like, I couldn't see myself finishing it. And I had to be honest with myself, you know, because some people have the capacity to study. But me, I did that before when I didn't have kids. I can study for 18 hours, 19 hours. I can just wake up and study from morning till night. But with commitments, kids, job, literally it is very hard for you to merge everything and still study for a long time. So if you have a lot of commitments, just aim for 2 to 3 hours every day, okay? And I used GKIMED, so just go through everything, all their physical examination, just go through all their OSCE stations. In fact, they are high yield, all the musculoskeletal, mental state examinations for all types of cases, even like the cervical screening test, you know, the vulvar, bimanual examination, abdominal. In fact, just do everything in terms of their physical examination. Keep on repeating all the steps and all the sequence until you're sure that you mastered it very well, you know, before you be sure that, okay, you're ready to do the examination. So those are the key things that you need to know. So if you prepare yourself well, at least physical examination, you must get 4 physical examination. 4. So you know that, okay, in physical examination you're ready, you've prepared very well for your physical examination. You prepare yourself very well for theoretical aspects, you know, you find out that, okay, in theory you're ready. You prepare yourself for examination interpretation. Prepare, like, even CT scan, ECGs, you know, normal, even blood, thyroid function test, iron studies, all those normal blood, liver function. Just read all of them, because you don't know the one that will come out in your exam. Okay, now you will then go to your normal, like, medicine, pediatrics, obs and gynae, just general cases that they ask, in surgical cases, even things like preventive health cares, like cervical screening test, like the bowel screening, you know, all the screening, lung cancer screening. You have to just prepare, like, on a general note, you know, sexual health. So I mean, if you do, the courses will just guide you so that you study what is relevant for your examination. So that is why I personally recommend the courses, especially for AMC clinical. You know, for your AMC MCQ, like, I do not even recommend any courses, because me, I didn't do any course. I studied and I passed. But the clinical, because of the way the exam is structured and the fact that you literally need to understand how to talk, how to express yourself, and how to manage your time. Trust me, you only have 8 minutes to do the task. You have 2 minutes to, like, read the question, and in the reading time you're not allowed to take notes, you're not allowed to do anything. But in the reading time you can start and be thinking, okay, how do I do this case? Then you look at your task. You only have 8 minutes, no matter whatever you do there, to finish your task. Okay, so it's 8 minutes. Even when I was doing my exam, the 8 minutes was running very quickly. Like, before I even say jack, my time was gone. So you literally also need to learn how to talk a little bit, not so fast, because if you talk so fast they won't understand you. At least if you talk, like, if you, let's say you talk like normal way, and then normal way, but you need to check time. You need to make sure that you're working hand in hand with your time. Okay, so that is actually the key thing that I thought about in AMC clinical. The exam, guys, is doable, and I mean, if you plan yourself well around your AMC clinical examination, then you would definitely pass. Okay, I'll be making another video to explain to you about the clinical pitfalls in AMC clinicals and AMC MCQ, you know, recent updates. And guys, keep following and keep subscribing to my YouTube channel. And I mean, if you love my video and if you love what I do, remember to share this video, and I'll see you in my next video. Bye.